here in person. We want to thank everybody here in person in Probasco and everybody online. We have a great session today linked directly to our mission and vision and values on compassion and empathy. I would like to introduce the subject matter experts really for this topic. We have Wendy Burns with us today, who's done a fantastic job with patient family advisory councils and really hearing the voice of the patient. And Marcia Collier, who has really jumped in with her experience with patient experience, rounding techniques, and how we really educate all staff on these topics of empathy and compassion as well. So without further ado, I'll turn it over to Marcia and Wendy.
My name is Wendy. He said that. I've spent the last 23 years as a child life specialist, and the majority of that time was in the emergency department, where I became fully engaged in the belief that compassion changes outcomes. I could see how physicians' interactions with families made or broke their ability to process information, that it set them up for success when they were discharged and able to go home and provide the care to their children that they were needing to provide, that allowed them to ask the questions they needed for clarification, that drove them coming back for follow-up appointments, all of those things. So I was convinced of that in myself from what I observed, but I didn't have the proof to show that. So when I was leaving Cincinnati Children's to return back here, I was given the book Compassion-omics, which I brought for you to see, and I want to give it a full endorsement. This should be a must read for everybody in healthcare because it talks about everything from patient outcomes and how compassion drives them to your institution or your office's bottom line to retention and burnout. This book has sparked conversations within the hospital between a lot of us. And it has been a link between Marcia and I when we talk about the work that she's doing with Press Ganey and data related to patient experience. So we're gonna move through this and hopefully give you some framework for compassion that you can put into your own practice.
Okay, and I'm Marcia Collier, and I've been a nurse forever. But most of my career has been, I was med surg for 10 years. Most of my career has been in patient experience. And my most recent, I worked for Advent Health and HCA in the Tampa area and shadowed over 50 physicians. And I think that's why I'm passionate about this topic, just because of what I saw. And it was noticeable that many didn't maybe know what empathy was, including myself, until I started teaching this. So I hope you will learn some things to take away today. So as Wendy said, a lot of what you're gonna hear, I got from this book, so I'm kind of giving an overview. So the first thing, I think this is very interesting, 1957, principle number 1 in the Code of Ethics, a physician shall be dedicated to providing competent medical care with compassion and respect for dignity and human rights. So principle number 1, there it is. So it's very important to know the difference between empathy and compassion, but also sympathy and empathy. So sympathy is really kind of, I feel sorry for you. It's like pity, it's outside looking down on someone. Empathy, you're putting yourself in their shoes. You're feeling what they are feeling. And that has to come first before compassion. So feeling what they're feeling, then compassion is taking action. It's that desire to help. So nobody judged this picture of the brain. It's probably in the wrong area, but it's just a visual. So they did an MRI brain imaging, and when a person experiences empathy, the pain centers actually light up. They feel pain, whereas when a person is compassionate and takes action to alleviate another suffering, a reward pathway shows up and it's positive. So compassion actually heals. So lack of compassion in the United States. Let's see, 50% of Americans believe the US healthcare system is not compassionate. Both patients and providers said the US healthcare system is not, but 3/4 of the physicians said, but we're compassionate. 64% said they've experienced a lack of compassion in healthcare, in a healthcare setting. So what we're going to show you now is a movie, probably older than some of you are, but the principles still exist. You're going to recognize it. So this gentleman is a surgeon, and he's a little bit full of himself. And he is going to have he had a tickle in his throat. So he's made an appointment to go see a colleague in the hospital where he works. And you're going to notice from the equipment that this is an older movie. So pay attention to her bedside manner, her body language, and how he feels. He's now the patient. He hadn't been a patient before.
Hello. Sorry to keep you waiting, busy day.
Jack McKee.
Yes, I know.
Right. Murray Kaplan sends his best.
Well, that's right. You're in practice together.
Well, we get it right.
What seems to be the trouble?
What? I have a tickle. I've been hoarse.
Back in the chair. Up, hands and knees, chin forward. And open. Let's take a look. Close. Open. Right. Open. Might be a little bitter.
It's an anesthetic.
Want to take a closer look?
Whoa, a periscope.
Won't be pleasant. Time out. All the way. And hold it. Your hand. Head forward. And open. And again. 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 One more time. And that's all I need. Doctor, you have a growth.
What?
Tumor, laryngeal. Here on the true vocal cord.
You know what laryngeal is.
Chest x-rays, blood chemistry, blood count, UA, EKG. I'll check with my secretary, but if it's remotely possible, I'd like to do a biopsy tomorrow. Okay?
Thanks.
No mention.
Compassion. Whoops, sorry. So sorry. So not very compassionate. So good example, health. So she wasn't feeling certainly what he was feeling. She was just going through the motions, right? Healthcare providers are not listening. You've probably heard this. There have been many, many studies. A most recent one, we interrupt our patients within 11 seconds. Why do we do that? Anybody have an answer? We're busy, right? We're busy. We don't have time. We don't want to open Pandora's box. But patients offer many openings for a response, and we miss between 60 and 90%. We don't pay attention to their emotional cues or opportunities to respond with compassion. So when empathy is not provided, some patients will repeatedly attempt to have their needs met. They will ask more questions and more questions. And if any of you probably don't have toddlers because you're in medical school, but if you are familiar with toddlers, when they don't get their needs met, they will continually tug on mom's pants or until they get it answers. And it's similar. So when empathy is provided, patients' questions decrease and then patients feel heard. So why do we miss opportunities? As I said before, maybe we don't have time, lack of insight, self-awareness. You don't even realize that you're missing opportunities. Don't have time, perhaps don't care. I'm burnt out. I see this every day. It becomes normal, so you don't even see it. Don't know how. It's not my personality. It's not my nature. Don't feel comfortable. Or I don't really believe it really matters if I'm compassionate or empathetic. Well, so now what? What do I have to do and how much time is this going to take? That's probably what you're thinking, right? We're telling you be compassionate, how much time? So 3 different studies. One, patient-doctor compassion opportunity sequence takes about 30 seconds. Another study, this was the CNO at Press Ganey, which is a company that does our patient satisfaction surveys. Meaningful compassion connection takes on average 56 seconds, no more than 2 minutes. And then a third, and you're going to hear somebody talk about this in a video in a minute, 40 seconds of compassion can reduce patient anxiety. So high physician compassion, it does matter. And this is kind of a synopsis of what is in that book. It calms stress, it lowers blood pressure, reduces perception of pain, builds trust, can reduce back pain, headache, irritable bowel syndrome, improves the quality of life. Patients in palliative care survive 30% longer when they experience compassion, and optimal blood sugar control was 80% higher. Those are just some of the studies and research mentioned in the book. Also, psychological effects. So when a therapist uses compassion, it reduces depression. When nursing aides demonstrated compassion, it lowered depression in nursing homes. It alleviated anxiety and distress in caregivers, when caregivers use this with cancer patients. And there was evidence that early interventions using compassion reduced the likelihood of developing PTSD. I love this quote, 1963, when pre-op patients experienced a rapport-building compassionate connection with a doctor, anesthesiologist, and nurse before surgery, there was a reduced need for both sedatives and post-op pain medicine. So now I'm going to tell you a patient story. Who here remembers senior year in high school? Remember that? Do you recall? Yeah, senior year, it's exciting. So many things happen. It's like your end of your high school life. So this is a story about Allison. She, senior year in high school, first week of school, driving to the first football game. And she has her 2 friends with her. She's the driver. Light rain, 6 o'clock at night, it's not dark. And all of a sudden, going 35 miles an hour, boom, out of Starbucks, a lady rams into their car. The car is totaled. The girl next door, there's blood But the three of them get out of the car. They're okay. The girl that was bleeding has stitches. They go to the ED. The girl with the stitches is the only one seen. The other two are okay. And back to life as normal senior year. A couple months later, the driver, I put this in here because it's a Facebook post, got accepted into my dream school today. I'm a second generation dog. See you in the fall, Athens, filled with excitement. And today's a good day to be a dog. Just saying. So a little while after this, about the same time, this girl, senior year, she starts having periodic numbness in her thighs. Her foot is numb. 4 days go by, she's fine. If you haven't caught on, I'm the mother. Okay, I'm the mother of this girl. I'm a nurse, not an orthopedic nurse. I'm also, she's my third teenage daughter, and I'm a little burnout. Okay, I'm not listening. Like, yeah, your leg is numb. 3 days later, she's at the mall. I'm shut down. I'm not listening, and it didn't mean a lot to me. It's 2 months, 3 since the accident. I don't have a connection. Again, not an orthopedic nurse. So my son, who had just graduated chiro school, it's the holidays, he goes, Mom, you got to take her in. You got to have her see someone. So I ask around. The good part about being a nurse in the hospital, you find out who's best, right? But I got a name. Orthopedic surgeon. He was rude, condescending, not nice, barely looked at her, and told her to go to physical therapy. Okay, so three weeks later, I'm thinking this isn't working. This didn't feel right. Someone else said, you got to go see a neurosurgeon based on what, we think. So I looked, asked, found the best person possibly I could find. Dr. Ali Khani works this is all in Tampa, brain surgeon, had never met him, heard he was good. So we go see him around the end of February, and he shows us this picture. So some of you may know what that is, but you can tell what's circled. That doesn't look too good, does it? It's not aligned. And he basically said, you have to have surgery. You don't have a question, you have to have surgery. If we don't fix this, could be paralyzed at some point. And so it's the end of February. She's, you can't wait till summer. She's, okay, senior year, remember? And he takes out his phone and how about like around maybe, right after spring break, and her eyes fill up with tears. And she says, but prom's April 14th. And my birthday, I'm going to be 18 on April 20th. And he's looking at her and just keeps looking at his phone. And she goes, and then graduation. And he's looking and looking. He goes, well, how about April 26th? It's a Friday. His nurse is sitting down there, and she looks at him and he looks at her like, I'm going to make this happen. She wants to say, you don't work Fridays. You don't even know if the OR is free, whatever. He goes, we're going to do it April 26th. He went around his entire schedule to meet this little teenager's needs and made it happen. So April 26th, long 7 hours. It was very stressful. ICU that night. It was horrible. But within 3 days, she was home. She barely used a walker. This is what they did. So you can see the screws, the rods. It was amazing. And she made it to graduation. She has a brace on, but she walked across that stage, got her diploma. And I tell this story because I have never seen her face light up with more love and adoration that I haven't seen it before that. I haven't seen it since that when Dr. Ali Khani walked into her room, she loved this man. He loved her too. And because of him, she did well. And you can just see his stars. It's not just us, everyone loves him. He's an amazing person. He doesn't even have children, okay? So you can't say, oh, he was thinking about his own daughter. He wasn't. So again, I say that, and there's evidence in this book, right? So how patients do may depend on how they think they will do, but it's a doctor's responsibility. And when they provide hope and caring, and they cared about her as a person, and she adored him, she did well. She did much better than with that other person, right? So the accomplished doctor has a bedside manner that is humane, compassionate, empathetic, and supportive. So what do patients really want? Again, I just said it's all about relationships. So 87% kind treatment is more important than wait time, travel distance, or cost. I want dignity and respect. I want to be listened to carefully, truly care about me, value human connection and caring is more important than graduating from a prestigious medical school. And 90% would switch if they were unkind, which is what I did and I have done many times. So Press Ganey, they do all of our surveys again. They have what's called key drivers. So key drivers you can see here. Doctors are in there. They took time to listen. They showed concern for comfort. They address emotional needs. And so how do you do that? It's easy. It doesn't take that time. Sit down, you lean in, direct eye contact. Again, you listen, you care, no interrupting. Those are just some of the things. So this is right from Erlanger's Press Ganey surveys. And this, I like Dr. Rowe, but it was the other doctors, residents or something. They were aloof and seemed to come into my room just to check off the box, so to speak. They did not smile or show any kind of real concern. They were concerned about how well they did regarding the surgery and not about my well-being. To me, they already acted as if they were entitled. Compassion cannot be taught. Either you have it or you don't. They did not have it. Another comment, all of the doctors that I spoke with were wonderful except Dr. X. I will never forget the way she made me feel, how terrified I was, how cold she was. I had a million questions. I was in shock, and she acted as if she had better things to do than to talk to me with compassion. Now, it's not all bad, so here are the good ones. Dr. Campbell questioned me about my blood pressure. He gave me reassurance. I've never had such positive interactions with an anesthesiologist. Good experience. Doctor shows concern. Dr. Stanley was kind, patient, informative. I love Dr. Higgins. He was personable. They were patient and spent all the time needed with us, never felt rushed. So you can again see what patients really want. So now what we're going to do is this, we thought about cutting this down, but as we looked at it, we just can't cut it down. This is 15 minutes. And this is actually a TED Talk from the author of this book. And he gives a great synopsis of many of the things that are in the book. Let's see here. Oh. Sorry. Okay.
In my job, I meet people on the worst day of their life. I'm an intensivist, a physician who specializes in intensive care medicine. If you become my patient, it's because you need life-sustaining therapies in the ICU. Lately, I've been rethinking how I care for people. Let me tell you why. On February 27, 2007, on a snowy stretch of highway outside of Uppsala, Sweden, 2 buses collided head on. This is what was left of one of the buses. 6 people died, but miraculously, 56 people were saved. 5 years later, researchers asked the question, what do survivors remember? They interviewed every survivor, and using a rigorous qualitative research methodology, they found 2 common themes in the data. The first was expected, the physical pain that they felt at the moment of impact. But the other theme, a lack of compassion from the caregivers at all the hospitals. That's what they remembered 5 years later. These data have begun to open my eyes to a stark reality. In healthcare, we are in the midst of a compassion crisis. Scientists define compassion as an emotional response to another's pain or suffering involving an authentic desire to help. It's different from sympathy or empathy, which are the feeling and understanding components, in that compassion also involves taking action. So here are the data. Research from Harvard University found that nearly 50% of Americans believe that our healthcare system and our providers are not compassionate. 2/3 of patients have had a meaningful healthcare experience with a lack of compassion. Rigorous research show that 70% of opportunities for compassion are missed by physicians, and compassion comprises less than 1% of all communications by physicians to patients. These data are compounded by an epidemic of burnout in healthcare providers. Burnout is characterized by depersonalization, which is an inability to make a personal connection. And in the era of electronic medical records, rigorous research shows that healthcare providers spend more time looking into computer screens than looking patients in the eyes. Based on all of these data, I conclude we have a compassion crisis indeed. But here's the big question. Does it matter? Does compassion really matter? Now, you may say, of course, compassion matters. We have a moral imperative as part of the art of medicine. And of course, I agree. But is compassion just in the art of medicine? Or are there also evidence-based effects belonging in the science of medicine? And what is the evidence? In addition to being an intensivist, I'm also a physician scientist. In other words, I'm a research nerd. I like data, and my hypothesis was that compassion matters for patients, for patient care, and for those who care for patients. So I went to the biomedical literature, and I used a methodology called systematic review. So over 2 years through the National Library of Medicine, I reviewed more than 1,000 scientific abstracts, more than 200 research studies in total. And today I share with you what I found. The effects of compassion on patients, on patient care, and specifically the cost of care, and on those who care for patients, our healthcare providers. There are more than 20 distinct mechanisms of action by which compassion can have beneficial effects on patients. Let's go to the data. Let's start with the practical. If you have compassion for patients, you may be more likely to be meticulous about their care, or have higher quality standards and lower likelihood of making a major medical error. But there are also physiological effects. Compassion can buffer stress-mediated disease. Compassion can also modulate a patient's experience of pain. There are neuroendocrine effects. So in patients with diabetes, research shows that high physician compassion is associated with an 80% higher odds of optimal blood sugar control and 40% lower odds of acute metabolic complications. There are also immune system effects. So in a University of Wisconsin study in patients with a common cold, high physician compassion as rated by patients was associated with enhanced immune response, shorter duration of symptoms, and lower severity of symptoms. And importantly, compassion can impact patient self-care. If you care deeply about patients and they know that, they may be more likely to take their medicine. In a Johns Hopkins study of 1,700 patients with HIV, researchers asked patients, does your physician know you as a person? Knowing the patient as a person was associated with 33% higher odds of adherence to therapy and 20% higher odds of having no detectable virus in the blood. Compassion has also been associated with lower healthcare costs, which are a major factor in the health of our economy. In primary care, for example, research from the University of Rochester and UC Davis have shown that compassionate, patient-centered care is associated with lower discretionary resource utilization. So fewer diagnostic tests, fewer referrals to specialists, fewer unnecessary hospitalizations, and lower total healthcare charges. So here's the bottom line. If healthcare providers actually spend more time talking to patients, maybe we don't need so many tests and referrals. But what about time? We've all heard the expression, time is money, but time is also a vital factor in the efficiency and the economics of healthcare. So here's a staggering number, 56. Research from Harvard University shows that 56% of physicians believe they do not have time for compassion. This is in the context of a classic study from Princeton University on helping behaviors, which found that it wasn't the intrinsic belief of the importance of helping by the potential helper. It was whether or not the potential helper believed they had enough time to help. So how long does it actually take for a meaningful expression of compassion? To address this, researchers from Johns Hopkins University did a randomized controlled trial in patients with cancer who were having a consultation with the oncologist. And in this randomized trial, the primary outcome measure was anxiety. And if you have cancer, it's a pretty important outcome measure. So they found that patients randomized to a compassion intervention from the oncologist had less anxiety than usual care. So what was the compassion intervention? I could describe it for you, but instead I'm just going to read it to you. From the oncologist at the beginning of the consultation. I know this is a tough experience to go through, and I want you to know that I am here with you. Some of the things that I say to you today may be difficult to understand, so I want you to feel comfortable in stopping me if something I say is confusing or doesn't make sense. We are here together, and we will go through this together. And at the end of the consultation, the oncologist said, I know this is a tough time for you, and I want to emphasize again that we are in this together. I will be with you each step along the way. So how long did that take? They timed it, 40 seconds. So this randomized trial shows that all you need is 40 seconds of compassion to make a meaningful difference. Importantly, 40 seconds of compassion can be a powerful therapy for the giver too. And this is important because these data are not just applicable to healthcare workers, but to everyone here today. Science shows that compassion for others can have a direct positive effect on your own well-being. Neuroscience studies show that compassion for others can trigger reward pathways in the brain and positive emotion that can buffer or even counteract the activation of stress pathways and negative emotion. So, in effect, compassion for others can make you forget your own worries, at least temporarily. So now this is where the science meets the personal. A couple of years ago, after nearly 20 years of working in the ICU and meeting people on the worst day of their life, I came to a stark realization. I had almost every symptom of burnout. And let me assure you, that's not a good place to be. It can be a dark place. Currently, the recommended prescription for burnout is what I call escapism. Get away, detach, pull back, go on some nature hikes or whatever. But I was not buying it because I believe that the antidote to burnout had to be at the point of care, in personal connection human connection, not an escape. So what was I supposed to do? Well, I did the only thing I knew how to do. I took the research nerd approach. And armed with the data that 40 seconds of compassion can be a powerful therapy for the giver too, I decided to do an experiment on myself. I was the only research subject in this experiment. I was the N of 1. So I tested the hypothesis that my 40 seconds of compassion would transform my experience. I connected more, not less. Cared more, not less. Leaned in rather than pulling back. And that was when the fog of burnout began to lift. My 40 seconds of compassion changed everything for me. Now, you might be thinking, I'm speaking on the power of compassion. I must be the most compassionate doctor. But the truth, if I'm being honest, is that I'm still a work in progress. I'm working hard at compassion every day, but I see it now. And thankfully, science shows that change can happen. I used to think that people were either wired for compassion or they were not. But the preponderance of evidence in the scientific literature, both in healthcare workers and in the general population, shows quite clearly that compassionate behaviors can, in fact, be learned. And that is good news indeed. So now it's time to answer the big question that I posed to you at the beginning. Does compassion matter? My systematic review of the literature now complete. 1,000 scientific abstracts, 200 research manuscripts, and one life-changing N of 1 experiment behind me. I now conclude with confidence, compassion matters. For patients, for patient care, and for those who care for patients. Compassionate care belongs in the domain of evidence-based medicine. I no longer believe in this paradigm behind me, this historical paradigm. I now believe in this one. Because I found that there is science in the art of medicine, and the science is strong. I like to call this field Compassion-omics. It's the convergence of the science and the art of medicine. I will close just by acknowledging that you don't have to be a healthcare worker to feel burned out. And if you do, I suggest that you test the compassion hypothesis for yourself. Do your N of 1 experiment. Look and see those around you in need of compassion and give them your 40 seconds of compassion. See how it transforms your experience. But don't do it because I say so. Do it because science says so. 40 seconds of compassion can change everything for a patient. It changed everything for me. It can change everything for you too. And that is the power of 40 seconds.
Okay, so next we're going to go in on Zoom here, and I've invited Dr. Mannion. So let's see if he's. Oh. Dr. Mannion, are you there?
Hi, Marcia.
Hi, I see you. Okay, welcome. I've invited Dr. Mannion. I had the pleasure of shadowing him, and I certainly witnessed compassion. And I wanted him to just talk about his experience. Did he learn it? Is it natural? What it does for him, what it does for his patients.
Well, thanks, Marcia, for inviting me to this topic. I think most people see me running around the hospital, and I think doing a lot of things, but in the things that we do, I think it's important to just conceptualize that we're taking care of people. So for me, a lot of it has to do with just thinking about people like a family member and hoping that they get care like we're going to give them in that room and at that moment. And sometimes I think it's difficult because we all are pulled in multiple different directions. As I think that day we were coding someone first thing when I walked in, and then we moved from having a difficult conversation to taking care of people to discharging them all within an hour. So I think it's important to just, as stated, just to make a moment in your day and moment with patients to take time with them. I think it's something that's trained, but also something innate probably for me, and it may be different for other people. I'm sure that some people have to work very hard on it and just try to make a moment. And some people also try to box up some of the maybe emotions that they have to try not to let that get to them. I think it's more important as a physician to be engaged with people's health, which can also be their mental health, which is everything that they're going through at that moment. So it's probably better not to box it up, because I think the care is better when we're with our patients in that, and not just as scientists in the room. So my feedback, and I think the way that people do it, is maybe sometimes shadow someone who does it well, try to get tips from them. I always find that trying to sit down, if possible, can help a conversation. I think a lot of people try to do that. On rounds, I actually don't sit down. Sometimes there's not chairs for us to sit down. There's not a place for me to sit down. But I think people can understand when you're just sitting in a moment and talking to them calmly and spending some time, that itself is you spending time with them. And that sometimes your pace of the way you're talking can help also show that. So I think they're all learned things. So I think finding people that do it well and shadowing them and understanding that can be helpful.
Thank you. Thank you so much for joining us.
Yes, definitely. Thank you.
Okay. All right. So next we have, let's see here. Wendy's going to take over.
One of the benefits of my job is that I really do get to sit face to face with so many patients and their families. And in pediatrics, primarily the conversations that I'm having when I am in my family advisory role would be with the parents. The family advisory teams that have been set up allow me to have access to parents to tap into for things like this. So I reached out to Whitley's parents, to Brian and Paige, to share a little bit. I told them that we were talking on compassion, and I wondered how their experience was impacted by compassion. She wrote to me, so I'm unfortunately not going to play a video of them, but I'm going to read to you what she says. And as I read through this, listen for what her memories are, what the things are, her takeaways from years of care for her kids. Wallace and Whitley Runyon were born on July of 2017 at Erlanger Hospital. As parents, we were aware that Whitley would only have one kidney. We grieved for what she might endure. Her actual diagnosis after birth was unimaginable. She was born with VACTERL association. V is for her missing vertebrae, A for imperforated anus, C for 2 holes in her heart, T is for her tracheomalacia, R is for renal abnormalities, missing kidney, neurogenic bladder. We were blessed that she was not affected by limb dysplasia. Dr. Bhattacharya was the first specialist, surgeon, we met. He prepared us for the first surgery. Whitley had her esophagus repaired at 48 hours old. The surgery was a wonderful success, and so is Dr. Bhattacharya. Whitley spent 30 days in the NICU. She had a blood transfusion and 2 very close calls. The NICU nurses were wonderful. Whitley had constant care. We as parents were informed of all her health issues. The nurses not only did their jobs, they were also very caring and supportive. Dr. Bhattacharya did Whitley's pull-through surgery in February of 2018. Unfortunately, Whitley's body rejected the repair. We spent 20 of 28 days of February in the hospital. It was a very hard and rainy month. We met so many doctors during this visit. The kind people from Child Life became our friends. Each day, someone from this group would bring her a new toy. We were seen by Dr. Hers for urology. He was very kind and understanding fellow. We adored his nurse practitioner, Kelly Stokes. They are both truly missed. It was so reassuring to call with an issue and know that your child was in with the best caregivers. Dr. Windemuller is in charge of Whitley's GI care. He spent many days in the hospital with Whitley. I can remember him stopping in the room just to say hi. He came to check on her as a person, not just a doctor. In 5 months, Whitley had 12 cleanouts in the hospital. Her colon is diagnosed as slow moving. The doctor made a point to speak on each trip. Dr. Kreth is her pulmonologist. He's made sure Whitley has a clear airway since birth. He always hugs Whitley at every visit. We love his bow ties and his cowboy boots. He makes a child feel at ease at every visit. We spent Halloween of 2019 in the hospital. Whitley got to pick out an outfit to trick or treat. She was a beautiful Minnie Mouse. It was amazing how the staff rallied to make sure that Whitley got to enjoy that holiday. Someone would do backwards trick or treat and bring goodies to her room. Whitley got to meet Miss Tennessee in 2019. She got pictures made and her autograph. It's very emotionally draining to spend days or even weeks inside a hospital room. When your child is confined to a bed, you as a parent are also confined. You sign a waiver saying your child will always have an adult present. You fear you'll miss a doctor's round if you take a shower. At night, you wake during nurses' visits. However, you remember the kind faces and kind words of the doctors, the nurses, Ronald McDonald House, volunteers. I still remember how Whitley was excited to pick out that Halloween costume. She begs for Child Life for every ouchie. The ER check-in individuals know us by name. Surgery group jokes that we have our own room. It has been difficult, but we have been blessed. Whitley's condition will continue to require medical interventions, and we will always be thankful for the amazing people at Erlanger. Dr. Bhattacharya, would you please come up at this time? I didn't give him a lot of forewarning, but sometimes those hallway meetings are for a good reason. So I would love for you to share how compassion has impacted you as a physician.
Well, thank you. Yeah, I didn't know about this till about an hour ago. So, and I didn't know that you were going to present Whitley's case. So, she's obviously a very special young lady, and kind of piggybacking off what Dr. Maniam said, I think when you spend time with a family, whether it's like they said the worst day of their life, or even on morning rounds, there's a thing that Bill Clinton always did. He made you feel like you were the only person in the room. And when you talk to a parent, for me, which is usually the parent or the kids, making them feel like they're the only person in the room, it's an absolute vacuum of attention placed on them. And that's a space for them to always feel like they're heard and they're always remembered. But I was just talking about Whitley just the other day because I saw her in the ER just walking through, and she jumped in my arms, and it was like, I got a picture of it because it's like something I remember. And you're going to have so many really bad days or bad minutes or bad hours in the hospital. And if you don't capture those fantastic minutes and fantastic hours and fantastic days in the hospital, then you'll never remember why you're doing this for. And then again, with very little preparation, I'm speaking completely off the cuff. For me personally, in the children's hospital, there's a unique mission, which is caring for a child from the time they're born until the time that they, as I always tell people, first off, when a child's born with a congenital defect, is I think people forget to congratulate them. They've had a child. For this family, actually very specifically had been wanting a child for a very long time. And while this child was born with some very challenging medical issues, I think people forget to congratulate them on the birth of twin babies. That's fantastic, right? So, recognizing them in their place in life, but reminding them that today is going to be hard and tomorrow is going to be hard and this year is going to be hard and 5 years is going to be hard. But there's a day where Whitley's going to go to prom and she's going to eat a steak with her buddies and go to college, and she's going to be able to do all of these things. And if you get bogged down in the fact that I've got to fix her esophagus in the first 48 hours of life, it's really hard to get up the next morning. But if you remember that she's going to be going on to be a productive member of society, and the esophagus that I fixed at 2 days of life is going to last her 80, 90, or 100 years, is really a phenomenal it blows me away every day I wake up that this is what I get to do. But I think that gives me a secondary mission. And those of you who know me well know that not only do I try and work with my patients and do stuff within the hospital, but there's a whole network of things beyond the hospital, which makes me a whole person. It's not just being a pediatric surgeon. It's not just being a father. It's not just being a husband. I work with the For Spence Foundation, which provides all the kind of soft needs for children in the hospital. I work with the Ronald McDonald Board. Those things kind of make your life feel whole. And the culmination of that is that every day on the way to my daughter's school, we pass by a man without a home who sleeps on the side of the road at the corner of Macaulay and Georgia Avenue. Every day we see him. Every single day we see him. Every single day we talk about him, because he's a person and he's sleeping on the ground. And I think a couple of months ago, the city or the county took away his bench. And we talk about it, and then he's sleeping on the floor, and it was 10 degrees the other morning. And she says, I wonder if he had a dream last night. We don't know his name. We don't know who he is, but my daughter, who's 6, recognizes that's a person who's sleeping in 10-degree weather and wonders if he has a dream. So, if you think people aren't watching, I realize medical students are watching me, residents are watching me, my peers are watching me, your kids are watching you. The way you live your life every day, from the time you wake up to the time you go to sleep, is really, really important. And there are people that remember things about you that you will never remember. And it's, I don't know, it's a burden and a blessing. And I'm glad to carry the burden for the blessing. So anyways, thank you guys.
Okay, John, I'm hoping I can just click on this. I cannot.
I will receive.
I will never come for tech support's job, ever. It's over here. Here we are. Okay. Yeah. Thank you. These parents were so eager to share their story. I'm just going to let them tell it, but I want you to know that it has not been long since they lost their baby. And yet Compassion has completely impacted their ability to move forward. I'll let you hear from them.
This is Shirley, and this is my wife, Katie Shirley.
Hi there.
We're here to talk about compassion today. We're the proud parents of Charlie Bo Shirley.
Charlie Bo.
And he is a bundle of joy that we had for 5 months, born on April 1st of this year, of 2022, I should say. And we're going to mention some of the times we had some compassion and the outcomes and the impacts it had, and the unfortunate times where maybe we didn't have that much compassion. And just want to say that as we were reflecting on this, we came across and our head and hearts had were called more times with compassion than times without compassion. And we're very thankful for that, and for the whole entire Erlanger staff. Compassion for us was really important, and we had so much of it where the physicians truly connected with us on a parental level. It felt as if we were talking to mothers and fathers and not doctors and practitioners. And we really appreciated how they showed compassion by being very patient with us and helping us make it to the next step. That wasn't always the case, but they made us feel like we had all of their time, and helped for us to find the next prayer point and for us to find the next step. In the event where we didn't have compassion, I was thinking about what that felt like and what that looked like, and it was very factual. It was very direct, almost harmful, where the physician had just that, really, just the facts, and it led to not a lot of hope. And in the experience that we had right when Katie was coming out of the delivery, we were brand new, and in our first introduction was someone that only had the facts and didn't have a lot of compassion. And we didn't know, it almost felt contentious. And instead of showing up and advocating, it was more defending. And that was very harmful. Again, we very much understood the situation and what was happening, but there were other times there, though, when on the other end of the spectrum, we had physicians that were praying for us. We had physicians that were crying with us. It wasn't always doom and gloom.
And as a mother, that really means a lot, that you've got another person who is sitting there crying with you, and she might not be as scared as you are, that fear for your child's life, but she sees you as a mother who is hurting. And that was a real time that I felt the most compassion was when a physician cried with me. And I really felt that she saw me as a mom to mom. And it really made me feel good that not only do I have this person who's taking care of my baby and doing everything that they can, but she also cares about me and how I feel and how I'm handling this. And having physicians that prayed with us was a huge deal to our family, especially.
We never had a guard up, but those compassionate moments certainly helped us connect, because it felt as if the physician who had and brought compassion lacked a guard, lacked a barrier, versus the ones that only had the facts without compassion brought barriers and fences to that conversation.
When you think about it now, reflecting and after the fact, those are the physicians and practitioners that we talk about the most.
Mm-hmm.
And when we're telling stories about Charlie and celebrating his short life, those are the stories that we're telling, are the physicians that were compassionate, because it wasn't just in that moment or that day that they showed up for us. Those are lasting memories. And I hate to say, as many memories and wonderful things that we had, that one not so great interaction stands out also. And so I think that it shows that it's high stakes, because you can do all these wonderful things, but it just takes one time of not being compassionate that can really stick with a family. So one last thing I know that meant a lot to us is we really appreciated it and felt loved when people called Charlie by his name. I know that there's rules in the hospital, but baby Shirley just doesn't hit the same as someone coming over and saying, how's Charlie today?
Mm-hmm.
Or how are you today? And last tip is to, at least if you're not going to call them by their name, to make sure that you have the right gender. So nothing hurts worse as a parent when they come up and say how precious your baby girl is when you know it's baby boy. So we appreciate all that you do.
And we love you.
Thank you for everything.
Dr. Bennett. Also, I apologize for running that faster. This couple, for anyone that had met them, they're talkers. And so they told me, what is our time frame that we have that we can fill in, because you know who we are. And so I was giggling to myself thinking they really had to talk fast to try to get out the amount of story that they wanted to get out, but I made it faster.
No, well, I really wish we had more time, to be honest. What do you guys think? I know we force feed you HPP. So I'm just curious, what do you think? Eye-opening? Eye-opening. So the idea that people remember the experience and what they remember from that experience may not be what we would necessarily expect or predict. That's a great insight. What other thoughts came to mind? Did anyone feel conflicted? So I see a little bit of nodding. Anybody willing to just kind of share a little bit more about that? Discussions of compassion are not indictments. They're not guilt trips. That isn't what this is truly centered on. So if you feel that little bit of tension, just describe it if you don't mind. Yes, sir.
Number of minutes. Certain amount of time, we don't get marked down. So that, I think that's the conflict. It's not seconds.
Yeah,
Bounce off that, I think there's a fairly universal acknowledgement that it's important. I think it's interesting to look at data, but I don't think anybody would question that there's value in compassion, not just from a moral standpoint, but it's pretty obvious with patients feel supported that they improve this sort of literature. But one of the things I think Erlinger needs to work on there. So I've been personally told not to spend so much time with patients' families. I think particularly in settings where there's an urgency and programmers, and sometimes I think there's such an attention of efficiency and making sure the work is done well, which is appropriate, but there also has to be system level changes that everybody recognizes exist. But when I came in, that was something that I struggle with from first day is I think it's a recipe for burnout when your day from beginning to end, especially the 14-hour days, are consisting of constantly moving from one task to another and never stopping for real interactions with patients. And that was something I tried to counteract by just making decisions. I was just stay late. But that was met with actually like, okay, that's not a solution. So I think that has to be something that's supported from the top down.
there's a lot baked into what you're describing. You know, there's kind of the tensions between time and purpose. And gosh, I wish I could solve that one too. And yes, sir.
Like especially starting out like as an intern when I am not as experienced and am not as familiar with like treatment plans, like I kind of have to spend more time like learning all of that from the ground up and feel even more like pressed for time in the morning to like talk with patients. And I think that can like add on to getting into that habit of feeling rushed in the room with patients. So it's good to like have a reminder periodically that that's something that we should be like refocusing on and like getting that perspective from patients, families, like this is how we see your like rushed interactions.
I thought it was really interesting when they said that the residents seemed like they were just doing the check boxes versus the attendings didn't feel that, because as residents, we're supposed to present like we have 2 hours or 3 hours to make up a plan, come up with like chart review, and then see all of our patients, which sometimes can be like pressing, versus you as an attending, you can spend not as long as you want, but longer to see your patients.
I'm sensing you guys may also feel a lack of compassion for yourselves. I mean, I certainly have. I've had a similar sense that the system is about widgets, how many per unit time, right? Without much awareness of why I wrote a letter to Texas A&M College of Medicine and said, hey, please consider me. I think I can do good. And, you know, that is part of our big challenge. You know, part of why this discussion matters in the context of HPP, healthcare principles in practice, is to isolate this as a key principle. This represents something that is fundamental to not only good healthcare, but to your survival as healthcare providers. For too many years, too many times, we've seen good doctors, nurses, other caregivers leave the profession because they've felt ground up. And it's really, to me, a very important insight to think that expressions of compassion might actually reverse that and help patients at the same time. So that to me is a revelation. I think it's a powerful revelation. And my own experiment of one, I agree with it. I think it works. But we're doctors. We only believe in stuff that we actually do. A lot of people are like that. So it really is worthwhile, I think, to take that extra moment to call the patient by their name. Hi, Mrs. Johnson. Hi, Mary. How are you today? That little statement puts you in the right path, because the response you get will likely continue to pull that sense of regard for that other person. So as you're going through the list of patients and you're looking at your workload of the day and you're identifying, well, this patient's got this and that patient's got that. Well, they are not that. They are Mr., they are Miss, they are John, Mary, Felipe. And they happen to be here because they need help. And the why they need help, identifying that is probably our biggest job. We're diagnosticians. Lending a hand is all of our goals. And boy, it's awfully nice if we can have that sense of emotional connection too. So, Dave.
Jeff, sorry. I just wanted to add this in because this is a little bit off topic, but hearing you guys talk about your days, I'm not too far removed from residency, so I definitely remember these things. And I'll just, and you don't have the misfortune of being one of the residents in the surgery program where I get to chew your ears off constantly in the operating room for like 8 to 10 hours a day. So, but I will say that as a trainee, which I did for 9 years, having something for yourself, which is beyond the hospital, is really, really important. For me, it was running and reading. And talking about having compassion for yourself, like you shouldn't feel guilty that you're not reading Harrison's textbook or making sure the notes are good for tomorrow. You should give yourself the grace of doing something. For me, it was very habitual. It was running every time I came home. If it was a mile, it was a mile, but or else you're living in Groundhog's Day and every day is the same day and you're getting up and logging into Epic and checking your phone. I think having Epic on your phone is like the worst thing in the world ever. You should not do it. You should delete it. I don't care what your attending tells you, just delete it. It's not healthy. But those things, I mean, if we're going to talk about compassion, like the fact that we have this abnormal computer in our pocket all the time that you can check the sodium and the troponin at 1 o'clock in the morning when it's not your problem, just don't do it. So anyways, find something for yourself and own it. And it'll talking about longevity in your career. So yesterday I was on a run on the mountain, on Lookout Mountain, and I ran into a patient that stayed in the hospital for about a month over Christmas. And the dad saw me and immediately got tears in his eyes because anyways, it was just a really poignant moment for me. But had I not made time for myself before I got home after cases to go run, I never would have had that moment. So anyways, I mean, it all comes together. So.
Yep. Setting healthy corners. Sorry?
You have read this.
I have read this. Thanks to Wendy, I've read this. And it means, I think it's worth it. I really do think it's worth the read, and whether you download it to Kindle or however you consume your reading time. So, you know, from Dave's perspective, you know, reading is a wonderful way to spend your free time when you have it. I know that as residents, you probably don't feel like you have much. I get it, but this is probably not a bad place to spend some of it. And even if you only read certain parts of it, I think it's a good reflection point on again, an important principle in what we do. And it's really hard to follow such admirable people, you know, who gave such poignant, points around how this affects them. So I'm not going to try and belabor that anymore. Thank you for opening up and talking about your own experiences. I know the mechanics of putting compassionate moments into your routines. There's going to be some tension and difficulty with that. And so again, just make one promise to yourself, make it small, but make it happen. If there's one little thing you can do that's different tomorrow than you did today, or as you leave us, as you go to see your next patient, one tiny little thing. Cherish it, own it, make it happen over and over again, and then build from there. You don't go from A to B in one step in most cases. I don't, I can't, I didn't. And I'm, going to try and keep doing that myself. So that's my only advice, leaving the floor. And I appreciate you guys spending this time with us. Thanks, Marcia. Thanks, Wendy. What a great job.
Good job. Good timing, huh? It's hard.
You tell us we got an hour, you say an hour and 15.
But look what happened. I mean, I do enough HPPs to know that,